Hello, my name is Dr. Daniel DeSimone, and I am Assistant Professor of Medicine in Hospital Internal Medicine and Infectious Disease at Mayo Clinic. I am also the lead author of the article, The Effect of the American Heart Association 2007 Guidelines on the Practice of Dental Prophylaxis for the Prevention of Infective Endocarditis in Olmsted County, Minnesota. It will be published in the June 2017 Mayo Clinic Proceedings. For over 50 years, the American Heart Association has published clinical guidelines for providers to prevent infective endocarditis, a rare but potentially lethal infection of the heart valves. The recommendations were to give patients with certain cardiac conditions who are risk stratified as having either moderate or high risk of developing infective endocarditis based on these cardiac conditions. Some of these conditions are very common in the United States population, such as mitral valve prolapse, congenital heart diseases, and having prosthetic heart valves. These patients were to receive antibiotics before undergoing certain dental procedures as well as other invasive procedures. However, there have been no studies to date that show that infective endocarditis is prevented by antibiotics before invasive dental procedures. Also, antibiotics given to an individual may be fairly inexpensive. However, when this is taken by millions across the United States population, this amounts to as high as over $100 million a year as a cost to the health system. Furthermore, indiscriminate use of antibiotics increase the risk of antibiotic resistance, as well as complications such as an infectious diarrhea known as C. difficile infection. All of these reasons in 2007 led the American Heart Association to recommend stopping antibiotics before dental procedures for particularly the moderate risk group, but to continue the antibiotics for those at high risk. This was a major reduction in the number of patients who would be receiving antibiotics before these dental procedures, as this moderate risk group makes up approximately 90% of the patients who would be receiving antibiotics, leaving only the smaller number of patients, approximately 10% of the patients, in the high-risk group who should still be receiving antibiotics where it's still recommended. This group of moderate risk patients would no longer receive antibiotics before a dental procedure. Due to this, there was concern amongst healthcare providers, dental care providers, that there would be a significant increase in the number of cases of infective endocarditis. Our prior work has examined the Olmsted County population in a pre-2007 and post-2007 study, and we determined that there was no significant increase in the number of cases of infective endocarditis, particularly to one microorganism called Viridans group streptococci. Why this bug is important, why we singled this out, is that this is the most common organism found in the oral cavity, in the mouth, and this is the target of antibiotic prophylaxis before these dental procedures. These works were published in journals, in the journals Circulation and Mayo Clinic Proceedings. A major limitation of our prior studies, however, leads me into our current article. These questions: has practice changed? Are dentists, healthcare providers following the new 2007 guidelines, or are they following the old guidelines back from 1997? This has been a question that no one in the United States has been able to answer. There have been several surveys to dentists, cardiologists across the nation. However, no study has been done that involved a complete review of medical and dental records to determine whether these patients are actually receiving antibiotics appropriately, or possibly more importantly, inappropriately. The Rochester Epidemiology Project is a linked medical records database that has allowed for population-based studies of Olmsted County, Minnesota for many decades. Recently, the Rochester Epidemiology Project has collaborated with local dental care providers in Olmsted County, which has allowed for the ability to study approximately 1/4 of the entire Olmsted County population. And this would give us access to both medical and dental records. This allowed our team to identify patients who have a moderate or high-risk cardiac condition living in Olmsted County, who then attended these participating local dental offices in Olmsted County to then access their entire medical and dental records, I would physically go into each dental office and review specific patients' dental records as well as their medical records to confirm their cardiac condition, and then to be able to access every dental visit that they had. So the date, the specific procedure they had, and whether or not they received antibiotics appropriately or inappropriately in accordance with the guidelines. We identified two major findings that I'll break down into the moderate risk and the high risk groups. So first, in the moderate risk group, pre-2007, where these patients were to receive antibiotic prophylaxis before dental procedures, only approximately 65% of the patient visits received antibiotics in accordance with the guidelines. Post-2007, through June of 2015, this group will no longer receive antibiotics before dental procedures. Only approximately 8.6% of the dental visits we identified received antibiotics inappropriately. In the high-risk group, prior to 2007, approximately 97% of patient visits received antibiotics in accordance with the guidelines. Post-2007, where this group continued to receive antibiotics, we actually found a significant decline in the number of patient visits where antibiotics were given when indicated, dropped from 97% to 81%. This finding was unexpected, as the high-risk group would not have been affected by the 2007 guideline change. Whether this is a lack of education for providers or confusion of the guidelines recommendations will require further study. What do these findings mean? Based on our study cohort, there was a rapid uptake of the 2007 American Heart Association guidelines to prevent infective endocarditis. And for the most part, the guidelines are being followed in our group. A small percentage of patients at moderate risk do continue to receive antibiotics before dental procedures, while there was a reduction in the patients at high risk receiving antibiotics. The next steps for this line of research include the enrollment of every dental office in Olmsted County, Minnesota. This will allow for a full population-based study and allow for further examination in the role of antibiotic prophylaxis and the prevention of infective endocarditis, if any. I'd like to thank you for your time, and I hope you enjoy reading the article, and I hope you enjoyed this video. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.